Avascular necrosis diagnosis in the early stages is quite difficult. It sometimes doesn't show up on an x-ray. In the later stages, it definitely does. And the head actually collapses. It's obviously very painful. Can't sleep at night. It's the standard symptoms like you get for hip arthritis as well. But the initial stages can be interesting because sometimes the management can be different. So if we haven't really picked it up on an x-ray, we might consider doing an MRI scan, which may show areas within the actual femoral head that are starting to lose their blood supply. So this is in a very early stage. Why is that important? Because usually in these early stages, we might try and avoid doing a hip replacement and do what's called drilling, which basically just sends a drill into the hip joint and basically tries to stimulate some kind of healing process. This will not, however, work very well in the latter stages of avascular necrosis when the head is actually collapsed. I'm not actually that convinced even in the earlier stages that drilling actually works either. And there's usually a sort of progression stage, but it is worth trying to avoid a hip replacement, particularly in young patients.